Kato, Katoa, and a very good afternoon. I'll start with my karakia. Manawa mai Timauri Nuku. Manawa mai Timauri Rangi. Kote Maori Ka. E Maori Tipua Ka Pakaro Mai Tipua. To mai Timauri. Omie Uye Taiki. Let me just start by giving you a little bit of an introduction of me. So my name is Ali Rasheed, and I'm from the UNITEC Institute of Technology. And the topic I'm going to look at in the science conference is the issues of mental health and suicide among South Asian communities in this whole pandemic, that is the COVID-19 or the coronavirus, COVID-19 pandemic. And before I present my area of research, I would also like to just to give you a brief about my research specialty. My background is education and public policy, and also the social work, which I'm currently lecturing as well. So one of the things that that has interested me in this topic is especially because of the PhD which I have done, which I looked at South Asian. It's about minority. It's about success in universities for minority students. And the group of minorities that I was looking at was South Asian communities. That is the domestic South Asian or South Asian migrants who have come here to New Zealand and live here. So that is one of the reasons why I'm interested in looking at this mental health and the issues of mental health and suicide, and looking at through a lens to look at the South Asian communities, because some of the findings of my PhD's thesis really suggested that many of these migrants who come here to New Zealand to study, they go through a lot of issues of mental health, and this is because of many reasons. And one of the reasons is also a lot of some of the people from the South Asian region. Substantial amount of people are refugees who come into New Zealand to live here, and so the push and pull factors, which is a phenomenon of immigration, puts them into this difficult, difficult situation where they are being, there's a lot of pressure upon them in terms of integration into society, irrespective of being a migrant or a refugee, but it's just coming into a new country and trying to be really integrating into that society is a challenge, because I myself have gone through that, so I can honestly, from my own big experience, I can tell you that what it was that I went through. I do understand that culture is something that evolves, and then we need, as migrants into a new country, we also need to adapt into the environment that we live in, so that our cultures get shaped definitely on that. Yeah. So So what I'm going to look at in this session is about the issues of mental health and suicide among South Asian communities, um, you know, with the pandemic. So the 2020, as we all know, the COVID-19 pandemic has necessitated a global public health response, which resulted in unprecedented nationwide lockdowns in New Zealand as well as many parts of the world. I mean, throughout the world, actually, I don't think there's any country that has not been out of that circle. So research on the public experience of pandemics have been relatively limited until really the end of 2020, and it did not really address the scale of the lockdowns, the impact on the lockdowns. So there was a rapid review of evidence of a psychological impact of quarantine with prior to COVID-19, which was found. The impacts were wide-ranging, substantial, and also it can be long-lasting communities. So, I mean, as I said, New Zealand, it was no exception. The impact of pandemic had wide range of effects on the New Zealand society, which I'm going to look at. And one of these key stresses were like duration of quarantines, infection fears, frustration, boredom, inadequate supply, inadequate information, financial loss, and more specifically, the stigma around these things. So communities in the past, who have histories of suffering from mental illnesses, and the social isolation meant that it has exacerbated the mental health issues within these communities. So the figures, I'm sure that you have come across the figures in the media. The media played a really an interesting role about addressing this pandemic. And so the figures that were reported in the media reported prevalence of incidents of mental disorders among especially elderly population within these communities, because they get more affected. But I mean, it's not to say that it's only the elderly, but it is also part of that. Right. So the lockdowns, and in terms of the lockdowns, we have seen that it has impacted directly or indirectly on job losses, and people, really had lost hope of many things, which sort of was more psychological. And also, as I have mentioned, the minority communities or the small minority ethnicities were much harder hit, because I mean they are also these communities are in terms of low socioeconomic income brackets and the lifestyle. The scale. So people express anxiety around contracting COVID-19 and infecting their vulnerable relatives, especially in their own bubble. So again, this was also something that we have seen. So lockdown in terms of lockdown, it has restricted more daily activities in terms of besides. The only thing that, especially if you look at New Zealand, in the context of New Zealand, it was the essential services that people have had. Except, we had along the initial lockdown, but then after the Delta, the lockdown was sort of, it went on for a long time, especially for Auckland in terms of the lockdown. So So the lockdown restricted almost all daily activities. So besides essential services, so anxiety was felt during these essential interactions because as social human beings, I think it's just you really wanted a social contact, and this is the only time that we have seen that people now the social. I mean, I mean, there has been sometimes bad benefits, but in this case, in the present, time, this is the time that we have only seen that or humans have been in a lockdown position or under what I call behind bars. It caused some people to restrict their activities even further. For example, just not even going anywhere past their own letterbox for the entire lockdown period, and especially again, coming back to the senior populations. This was much more, it was much more. They had much more fear. So as the lockdown continued, and also with the new Delta variant, the feelings of isolation resulted a significant mental distress for individuals. And the thing is, this is one of the reasons why I wanted to present this paper, because I'm quite interested in pursuing this to find out what the impact that it has on the South Asian community. So, there's there's a very limited data that's available in terms of ethnic background, and especially in terms of the group that I'm looking at, the ethnic group I'm looking at. We also have an issue in terms of ethnic reporting. Now, this is not only limited to the pandemic and the coronavirus of COVID-19, but this has been something that's ongoing because for Asians, they all on the New Zealand statistical systems or the New Zealand reporting systems do not report on South Asians as an ethnic group, but however they report that as Asians as a homogeneous group. But the interesting thing is, if you look at in terms of I'm talking about the official reporting, but if you go to the census, in fact, I have done that, because going to the census and looking at the South Asians within the Asians, the significant, one of the things that I looked at was the growth, inter-census growth, that's between the two censuses. And it was also reported by New Zealand, Statistics New Zealand, that one of the fastest growing population, the fastest growing, not one, but the fastest growing populations were Asians. But then I have this, what I have done is I have disaggregated this data to find out in terms of what is the proportion of South Asians. So it's about, I think it's about 37%. There is inter-census growth during the two censuses. Asians have grown by 33%. The growth during the two censuses, and from that, in that, 43% of the growth is attributed to South Asia. So it's a fast-growing population. So there is a concern in terms of addressing the issues. So in terms of, there were reports about people coping well financially, and this is also quite, again, another interesting element to look at, because they were saying that people were only limited to pay their bills and also provide for themselves and their family. So in terms of other spending has been, sort of restricted. That has helped them with. This was one of the reporting which said that has helped them with these people having a better life, right? So this was aided by reduced expenditure due to the restrictions, alongside also some of the payments that they received from the government as benefits. And also one of the things that happened also was in the winter time about the increase in the winter energy payments. Right. So although most of the South Asian communities were complaining about mental distress, now this is even before the pandemic, mental distress, accessing mental health services was a challenge. And especially this challenge was really was heightened with COVID-19. And in fact, this is, this is quite an interesting area even to have to look at, because one of the things that the hospitals report is about people coming to services. And we have seen in the lockdowns that even the cancer, so people who are suffering from cancers, those, I think there was a 50% reduction on people coming to hospitals in terms of doing their routine checks. But it does not mean to say that people were not suffering cancer. But the thing was, the whole thing about the lockdown and also its fear has restricted people going into the hospitals for their treatments. So people coped using self-help techniques. So which is yet to find out how it has helped the communities. So these included methods such as self-talk, relaxation techniques, and also there was themselves in feeling overwhelmed. So interestingly, and the other thing, one of the other things that I have seen a lot of research has been done is how many of these death has really attributed to COVID-19 deaths. Because one of the things that the media has been reporting and the government reports, and also worldwide reports were about COVID deaths. But again, it might be good to find out, maybe look at some comparisons over time to see in terms of other, like influenza, flus, all these things in other years, the number of deaths, and just comparing it with what has happened in the looking at the COVID-19 or the coronavirus. So a recent study on the mental health that published recently, it called to address the mental health state as a consequence of the increase in suicide rates that got reported. And Asians in general, but it's not been, and also the other interesting thing I would also like to raise here is about the mental health and the suicide. The reporting they have started, earlier it was much easier to see the suicide reporting, but now I think it's really hard to get that information or the data. So it will be important to look at that reported in terms of the suicide rates for the ethnic groups in New Zealand, and so in terms of what the statistics I have looked at, Asians reported the lowest suicide rates among ethnic groups in New Zealand, and that was and have a higher rate than the Pacific communities living in Auckland. So this report urges policymakers really to address the issues in order to create a better outcome for especially looking at the South Asian population living in Israel. And the reason being that it's a fast-growing ethnic population in the society, which is the intercensors have reported that. So it will be an issue if the government government needs to address that issue. And so the life during the COVID-19 lockdown has been challenging, and especially for lower income New Zealanders in general. It was, it's not the best time for them. It was fearful, they were fear of the virus. The lockdown has impacted negatively on the mental health, especially of the group that I'm looking at, because the reason why I'm addressing this is because they have already gone through, because it has shown that they have been through the mental health issues, and for them to really get into this pandemic, and that when they are not being when they don't have services offered to them, that really has not helped the situation. So so it's New Zealanders in general are still reporting negative impacts of mental health and income from coronavirus pandemic, despite living in one of the world's few countries to have largely that what we call return to. I mean, I wouldn't say return to normal, but we have been keeping our borders closed so that we can avoid the so the Pacific Island nations, which has had about the 2,200 cases and 26 deaths in a population of 5 million. So that's it is the impacts were low still, but which has been enforced by strict lockdowns and also the social distancing rules that have helped in terms of, I wouldn't say eliminate, but I would say that keeping the virus out. So yeah, so from here, I would like to definitely study the impact of this pandemic on the South Asian population in terms of their mental health, and more specifically to the suicide rates. Thank you very much for listening to my presentation. So let me start this. Let me finish this with the karakia. Ka wehe atu tato airaro ite nangimari tiharikoi mete manawa nui umie uie